Well, a warm welcome to this talk. Now, today we're going to be looking at a study, or the history of a study, if you like, from Queensland in Australia. It's called the QoVax, QoVax study. And this enrolled 10,600 people, and it started in July 2021. And it included all their clinical data from the superb data available in Queensland. It included biosamples, blood and urine samples. The study started recruiting in July 2021. It recruited 10,600 people, started to follow them up for a couple of years. Then all of a sudden, study seemed to be stopped. Now, the question is why, of course, and it's a real pity. This study, where the cessation of the study was suddenly announced in mid-2023. So not only that, there's plans. The authorities are planning to destroy all the samples, simply destroy all the samples. So unfortunate if this happens, massive loss to science. Proper longitudinal prospective data from the COVID era, including all the vaccine data. It looks like some people don't want you to see it. But who knows? Who knows? Anyway, let's get the full story now from Professor Wendy Hoy. Welcome to this talk, and a warm welcome to Professor Wendy Hoy from Brisbane in Australia. Professor, thank you very much for coming on.
Oh, you're most welcome, John. I'm glad to have the opportunity to share this message.
Me too. So you're a doctor, you're a nephrologist, and you've done a lot of haematology. I believe you've also got the Order of Australia, which is kind of an Australian damehood, really, isn't it? For services to chronic disease in remote and disadvantaged populations in Australia and internationally. And you're also a fellow of the Australian Academy of Science, which is quite an impressive accolade. But we'll go on for some time talking about that. But the main reason we've come on today, Wendy, it's a really important topic. Just introduce this study that we'd like to talk about, please.
Well, thank you, John. At the beginning of the COVID era, senior investigators at the University of Queensland designed a program to evaluate the effects, particularly of COVID treatments and COVID vaccines, as they were coming onto the scene. And they were in a position to do this because the Queensland Health maintains a fabulous system of health services data linkage by which it can track every individual in Queensland in terms of their hospital services utilisations, the costs, the outcomes, and their deaths. And they were set up perfectly to track the course of people with COVID and potentially the experiences of people who received the COVID treatments and the COVID vaccines.
Yep. So that was the study, and what was the intent? So basically, it's lifetime prospective. It's a really good idea, isn't it, to do studies in this way? What was the intent of the program? What data were they hoping to collect?
They were intending to collect, and indeed did collect, on the substance, on the people who were recruited, their past history as it related to their health status and their health events, their history of COVID and COVID vaccinations up to the point of enrolment, and then rolling forward all the health events and the health services utilisation events for a prospective period, which was intended to be, I think, perhaps 5 to 7 years.
Yeah. And which research institutions were involved in this? Was it a small team, or was it a collaborative effort across the state?
It was a major collaborative effort of all the major research and healthcare institutions in the state. Queensland is renowned for having some excellent health research institutions. In actual fact, it enjoyed the name of the smart state during the Peter Beattie era because of those wonderful institutions and the wonderful resourcing of those institutions. So that several of them were making their contributions from their various perspectives to this QoVax study, attracted to it by the importance of the questions it was posing and the able to offer the particular scientific expertise in which they had excellence. So there was the Queensland Health, there was the University of Queensland, there was the Berghofer Queensland Institute of Medical Research, there was Griffith University, and there were some other big league organisations as well, with different capabilities that they could bring to this multidimensional study and the analyses that would flow from it.
Quite impressive, and I believe they put 20 million Australian dollars into it as well. But it sounds like a who's who of medical and academic research in Queensland, so it's quite impressive.
Well, I would say in Australia, I would say many of these institutions, I think there are none better, in Australia certainly, and perhaps globally, in the things that they do, and in many ways they're correct. It is indeed a who's who of institution and expertise.
And how many participants were recruited, and how were they recruited, Wendy?
The objective was to get a representative sample of adults living in all areas in Queensland, which is a vast state, which is at least 7 or 8 times the area of the United Kingdom, and the sample size calculation to get results which would be robust for analysis was that they needed 10,000 adult recruits, and they in actual fact got 10,600. So they exceeded the recruitment quota, which was very pleasing to everybody.
And 15% of those were unvaccinated at enrolment. So this gives really quite substantial numbers that good statistical analysis could be carried out on this to give results that are fairly definitive. Do you think that's true, that this study had a lot of potential power?
Oh, absolutely. Absolutely. And the 15% of people who were unvaccinated, because the vaccines came a little later to Australia, is a fabulous opportunity for having them, as it were, as unvaccinated controls. The rest had one or more number of vaccines of the sort that was available as vaccines were rolled out, most probably in the beginning were the AstraZeneca vaccine and then the mRNA vaccines from Pfizer and Moderna as they became available. So a variable number of the vaccines and variable types of the vaccines over time, but all of those were documented very clearly in terms of number, type and timing.
So we know exactly the medical history of these 10,600 people. We know their age, their sex, all that kind of stuff about them. We know what vaccine they had, when they had it, and we also know when they had positive COVID tests and symptomatic COVID. So we know a heck of a lot about these 10,600 volunteers.
That's right. And then you asked what else was gathered on these people. In addition to getting their medical history and their vaccine and COVID history up to the point of recruitment, at recruitment there was a collection of biosamples, which included blood and urine, and that the blood samples included DNA sampling with the intent to see what genomic information might be associated with susceptibility to COVID, responses to COVID, and the reaction to the vaccines, the efficacy of the vaccines, and perhaps to adverse vaccine effects. And there were a couple of institutions in Queensland that are really second to none in terms of genomic analysis, and they were confident that this would yield good information.
And that blood could also, presumably, a researcher now could go back and say, well, I wonder if there's, I don't know, a particular antibody or a particular antigen in it, and go back and look at that.
Absolutely.
To gain additional biochemical information.
If there was that at baseline, they could check for it indeed. And because the biosampling occurred at intervals after recruitment, they could map sequential changes over time if these changes in any of these parameters occurred.
It sounds like a real gold mine, doesn't it? We've got really quite total information here. And the study started in July 2021, I believe?
The recruitment.
The recruitment started then, yeah.
The planning for the study, of course, has been over many months prior to that, but the actually activation of the recruitment began then.
And in your view, as a lifelong medical professor and academic and researcher, this was a good, sound research approach?
Real life observations, of course, don't lend the opportunity to control for every factor that you would in the study you designed and started yourself. But real life experiences are largely what matters. And we have it here, and we have the ability to follow it here without artifacts being introduced by constraints in prospective study designs, as it were. It was certainly designed by people who were expert in study design and epidemiology.
But the data can be collected longitudinally, so sadly, if some of these participants had died, the date would be known, the cause of death would be known. If some of these participants had had heart attacks or strokes or cancers at a particular point, that would also be documented longitudinally as time goes on.
Absolutely.
Yeah. And then what happened in mid-2023, about 2 years after the study was started?
Well, there was suddenly the announcement that the study would stop. This took everybody by surprise because the study was going very well, and neither the study team, including the principal investigator, nor the participants had any forewarning that such a decision was going to be made, and neither were they consulted about it and what might be alternate views on it, or what might be alternate strategies than just abruptly stopping the study. There was an announcement mid-23. Not only was the study going to be stopped, but that all the biosamples for the study would be destroyed within a year, and all the information on health services utilisation, the longitudinal information, would be quarantined so that it was not going to be accessible for ongoing inspection or analysis or reporting.
This sounds like the most extreme scientific vandalism to me, to actually destroy blood and urine and biosamples, making them none available to any future researcher or anyone in future who would have a simple question. They're just destroying them. The evidence will have gone.
It's the definitive way to make sure that those samples cannot be analysed for anything. Absolutely. The legality of it of course, is something that's currently being disputed by the legal challenges because it was never entertained in the information to the participants or in the participants' consent forms that such a thing would happen.
But if people have given biosamples, including blood samples, which means they need to be stabbed, to destroy that, I would consider that unethical. These people have given informed consent. They wanted to be in the study, and now they're being told they can't be in the study. And not only that, all the other medical data is quarantined from researchers.
Correct.
It just seems rather hard to understand. Had this study not been so, some might say, brutally terminated, what useful data do you think could have? Let's just speculate a little bit, Wendy. Just thinking out loud, what could have happened? What results could we have got from this? What would have been interesting to find out about over the next 5-6 years?
Well, we could have tracked the duration and severity of COVID infections, the frequency, severity and outcomes of long COVID, the benefits and the disadvantages of the COVID vaccines, both in terms of immediate effects, then intermediate term effects, then rolling over into months and years of follow-ups, long-term effects. Originally, the intent, I'm sure, was to document the benefits of the COVID treatments and preventative interventions, such as the COVID vaccines. As we learn more and more about the possibility that the COVID vaccines were educing, as it were, being associated with a wide spectrum of adverse effects, perhaps more than most companies and people had anticipated. We've been more focusing on opportunities to investigate in a very clear and honest way what the frequencies of such effects might be. Now, as we know, there has been a blockade on getting the true stories of the potential adverse effects of COVID vaccines presented in the general medical and health services literature. And this study most certainly would have had the opportunity to clarify much of that. And
sorry.
Go ahead.
I was going to say this study could have shown if there'd been, an increased risk of heart attacks after vaccine, an increased risk of strokes, an increased overall mortality. So the study was actually, for all we know, it appears the study might have been designed. We can't say, but the study could have been designed to show how great these products were. But then if information started trickling and it said, just a minute, unfortunately, we can't get to that information now. So we don't know, for example, how many people have since died in the vaccinated versus the unvaccinated group. That information is now gone. We can't find that out.
The health services information and the outcomes will not go away. It's there in the linked Queensland longitudinal health services data sets, and at this point is just quarantined. It can't be destroyed in the way that the biosamples are going to be destroyed. But if we just focus on the health services data, it in and of itself, biosamples aside, will be hugely informative about all those potential adverse events and benefits, of course, rolling forward. And this critical issue, or one of the critical issues, which is this unresolved one about to what extent, and if at all, are there premature deaths being associated with the vaccines over the short term and rolling forward. One of the most hotly contested issues in the last few years, as you may well know. This data set is wonderfully set up to answer that and many other clinical questions.
But that data is quarantined and the biosamples, we believe, are scheduled scheduled to be destroyed.
Correct.
Do the biosamples exist? So where are we now? In the middle of 2025. Do the biosamples still exist at the moment, or have they already been destroyed? Do we know?
Well, about 3.5 or 4 weeks ago, the biosamples were to be destroyed within 2 weeks. There was concerted action from people who have some reservations about the safety of COVID vaccines and the severity or not of COVID infections, who have rushed to assemble their protests and arguments against the destruction of the biosamples and against the quarantining of the health services information. They've had not much time to get their arguments and their thoughts together, but a series of events has occurred that I can run over briefly with you. They'll be happening sort of even as we speak. First of all, there was a very verbal protest by Senator Malcolm Roberts, a senator for Queensland, that went onto YouTube and is really worth watching, if you don't mind supplying that link to viewers later. And then there have been several articles written by excellent journalists who can express this situation much better than I ever could, and notably both Rebecca Barnett and Rebecca Weiser. They both commented on the threat to axe the QoVax and then the actuation, as it were, of the threat to destroy the biosamples and to quarantine the information as the announcement became a reality. And I've supplied the links to both those as well. They are truly superb. Then the legal actions have included the following. Forgive me if I read them out. All very recent.
These are in the attempts to stop the destruction of the biosamples.
Yes. On June 10, which is less than 2 weeks ago, a petition was presented to the Queensland Parliament to halt the destruction of the samples and to protest the cessation of the study. And the chief petitioner was a Mr. Alan Ballard, and he already had 6,800 signatures. I don't know what discussions have occurred in the Parliament or whether they're still pending, but that is a wonderful feat on his part. Then, amongst the legal actions, first of all, Mr. Julian Gillespie, who's known to you, John, and acting for the legal firm P.J. O'Brien, has protested on behalf of the study participants about destruction of the biosamples, with the legal argument that that would constitute the criminal offence of destruction of evidence and or potential evidence. And I might notice that Mr. Gillespie has for more than 2 years been a global leader in promoting the understanding and awareness of at least the DNA contamination of the mRNA vaccines and some of the potential implications. Then on another front, Mr. Gillespie has also challenged the axing of the program from the human rights perspective, arguing that participants have a right to know whether their biosamples might reveal potential health risks, regardless of whether mitigation, the possibility of mitigation of that risk in the future exists or not.
I think that's a really good point. There may be things that the doctors of these individual participants can do to improve their health in future.
Indeed, there may be. The beauty of this argument is that we don't have to know about those possibilities at this particular point. And that is very encouraging and far-sighted.
Yeah.
And in addition, a lawyer called Mr. Jaden Beale, who seems to have an expertise, well-developed expertise in human rights law. He belongs to Logan Law Firm. He's mounted a legal challenge to the destruction of the data and the material on the grounds that they're directly pertinent to the explicitly stated aims of the study for which participants gave informed consent. And that was the one that immediately sprung to my mind, actually, before all these other perspectives came into view. And the consequence of that, and things I hope are changing daily, is that only about 3 days ago, Queensland Health advised that there was going to be delay in the destruction of the biosamples pending its own legal review of the matter. So a court has been struck there. It's only a temporary delay, and we don't know where that will go, but at least there has been thought for pause there, or pause for thought in that matter. So this is an ongoing story, of course, and one that will be worth following.
Indeed. Yeah, let's hope those precious samples can be retained and not willfully destroyed. That would be a great loss to science and medical research, in my view, because it's pretty unique in the world, we believe, this data set. Now, of course, we can't speculate too much on who wants to destroy these samples or why would they want to destroy these samples, but I think we'll know more if we don't destroy the samples. So let's hope that these reviews are successful, that the data is unquarantined, and this is open to international researchers and peer review, so that definitive answers about the COVID era can be attained. Professor, thank you so much for coming on. Anything else you wanted to add just before we finish?
I would like to make the point, in the interest of being constructive and converting parts of this into a positive story, and as support accrues from interested participants and 6,800 people writing to the Queensland Parliament and one thing and another, I think we should explore the possibilities of resuscitating the program.
Oh, yes. Yeah. Let's. These 10,600 people, hopefully most of them are still there, and they can carry on. That's the whole point of a longitudinal study.
That's exactly right. And in terms of collecting the health services and health event data, nothing has been lost, because Queensland Health is constantly collecting that in all of us who avail ourselves of the Queensland Health Services.
That's just there. It's just that it's quarantined, that researchers can't access it.
On those particular people, it is quarantined. That's correct. And the biosamples, of course, if they're not destroyed, will continue to exist. Now, what hasn't happened is the repeated sampling of the biosamples over time as intended, but we could pick that up at any time.
Sure.
And I think if people were reconsulted in a civil way, and it was being inspected about how to minimise any losses and fallout from this, we should all be looking at ways to extract the maximum amount of useful information from this study. We'll have to, if truly Queensland Health has run out of funds to conduct this study and have allocated them to other health priorities, other health funding will have to be found. But if it was considered valuable to fund to the tune of 20 million a couple of years ago, it should still be very valuable to fund at this time. And answering all those questions about not only long COVID, but the possibility of adverse side effects and maybe treatable adverse side effects or predictable adverse side effects of the COVID treatments and the vaccines would just be hugely beneficial. So I would hope that a group can be reconvened, which includes the original researchers, to work out how that might happen.
Yeah, and to be quite honest, to keep a fridge running, to keep the samples cool, doesn't cost that much, does it?
It doesn't cost that much, and there are the options of additional storage facilities around the huge complex and numbers of research institutions
Of course.
that are here in Brisbane alone. Yes.
Of course. Yeah, it can be done, and in my view, it should be done. Let's hope it is. Wendy, thank you so much for coming on and going through that so clearly. And but please do keep us informed.
Indeed, I will. Thank you very much, John, for your attention and the opportunity to spread this message.
Yeah, thank you, Wendy.
Right.